So let me quickly and briefly explain how the yellow light therapy as a post-operative protocol using ElixirMD helps with reducing the inflammation and the recovery process post-operatively. So the yellow light therapy, which is light in the spectrum of the 590 roughly nanometer wavelength that has shown to penetrate the skin or the tissues anywhere from 0.5 millimeter to 2 millimeters. So if you look at the skin, for example, 2 millimeters, you're way into the deeper dermal tissues. That's where the lymphatic system, the blood vessels, the collagen, all these things lie that contribute to recovery, healing, swelling, lymphatic drainage, blood flow to the tissues with that tissue perfusion and transport of oxygen to the tissues, which ultimately is responsible for the healing process. Not just in the initial healing process as far as wound healing, but also in the inflammatory process that kicks in as part of the wound healing process. So the yellow light is, in a sense, an inflammatory modulator, as it also has shown, according to studies, to affect the inflammatory cytokines, mainly the pro-inflammatory cytokines like TNF-alpha, interleukin 6, to reduce the levels of those cytokines that then mitigate excessive inflammation, which clinically presents itself as excessive swelling, redness, or pain. So through that reduces those effects that we try to mitigate in the postoperative period. Further, through improving the lymphatic drainage, it helps whatever swelling that is accumulated postoperatively to drain that. And so these have been shown through studies to enhance the lymphatic drainage by reducing not only the interstitial, meaning the fluid that's in between the cells and in between the tissues. You know, we have fluid inside the cells and we have fluid outside of the cells called interstitial fluid, which is what we talk about when we say swelling. And by helping the drainage of that is why the recovery process is much shorter. So those are one of the main advantages of using yellow light in the immediate postoperative period for the protocol that ElixirMD recommends, which is every other day for 6 sessions immediately post-op.